Thank you to both of you for your presentations. We'll now proceed to questions from senators.
But I'd love to hear from both of you about what long-term is going to be the pressure of climate change for mass migration around the world, even if, I mean, it can be a prelude to war, an instigation of war, but it can also just, create the famine conditions that cause people to flee where they.
So we're also in the process of untangling, exactly what the relationships are between forced displacement and climate change. And I think that the best sort of explanation that I can offer is that thinking of it as a crisis multiplier is an important sort of mental framing and tool, because people flee for a variety of different reasons. And certainly we are seeing in some of our clinics, particularly in Central and South America, where we do have medical clinics along different migration routes. Certainly we hear of people who are fleeing simply because, the reality is that the lands that they used to grow food on and areas where they had lived for generations, is simply not usable anymore as a result of climate change. And so that creates an economic pressure that forces people into an impossible situation. If you're not able to grow food and earn money and support a livelihood, what option are you left with? There's other, more equally complex kinds of interrelationships between how land is used and what that means for, shaping communities and so on. But I think we're all very much aware of the fact that this is, as I say, a crisis multiplier, and something that we're going to have to pay very close attention to in the coming years.
But what I wanted to know from you is that you can't carry on this forever, in the sense that I know you think, I know you have the will to. What I'm trying to say is that there's such a lot of abuse, gender abuse of women. Where do we go from here? I know it's a very sort of pie in the sky kind of question, but it's just very hard to just see what happens to women in refugee camps.
So we've made great efforts to incorporate a comprehensive response to sexual and gender-based violence in our programming around the world. And by comprehensive, what I mean is a medical response, so post-exposure prophylaxis for infectious diseases, vaccinations, but also a psychosocial response. So we have psychologists and social workers and so on, who are a core element of our programming. So I think that there's two things that I'll say to answer your question. The first is that health systems around the world also need to be integrating sexual and gender-based violence programming into their basic package of health services. This needs to be accessible to everyone everywhere, because we know that sexual and gender-based violence is a massive problem everywhere on the planet. The second thing is that we experience and witness significant gaps in protection services and access to justice and legal supports. We are here to provide, as I say, the medical and psychosocial care, but there are immense gaps, once that element is in place, right? People need access to safe shelter. They need, in many cases, access to, protection services so that they're not returning to the community where, their abuser or the perpetrator may very well be. That's a huge gap in many places around the world. And so, we need to be looking at this as a holistic and comprehensive response to sexual and gender-based violence. And unfortunately, that protection element is too often not implemented. Now that, of course, is all in response to sexual and gender-based violence, and there is a massive, massive need to enact effective prevention programs as well, so that this isn't happening in the first place.
Study, and if we were going to ask the Canadian government to, to give support in, I'm not going to tell you what, X. What would it be? And you may need time to think about it. But, like with I know Canadian government does a lot with this issue, but I don't think enough, because the problem is so big. So what could you suggest? And perhaps you can write that in if you and start today and then continue?
Sure. So, and I'm happy to provide a slightly longer response. But, first of all, I want to acknowledge that the Canadian government has provided a lot of funding for sexual and reproductive health and rights programming around the world, and I'm just going to acknowledge that and say that that's a good thing. As I mentioned in my opening statement, there is a rapidly widening gap between needs and available resources. And I'm not suggesting that Canada needs to be the sole source of closing that gap, but mobilizing other donors to close that gap and meet the needs and actually stand up to their commitments is one piece of it. The second is that many of these problems are political crises. We as humanitarian organizations are there to respond to people's needs. We doctors can't stop bombs. We can't stop wars. These are political crises that require political responses. And so there is a role for, effective Canadian diplomacy in resolving these crises in the first place.
Sénatrice Gerba?
Merci, Madame la Présidente. Merci à tous.
Thank you very much, Madam Chairperson, and thank you to both witnesses for being here this evening. Based on the United Nations figures, apparently half of global refugees are women. In addition to their vulnerable state, and you said this yourself, in the north of Kivu, for example, these displaced persons are exposed to sexual and gender-based violence, and they need greater protection and more attention given to their plight. Now, in your opinion, and perhaps you responded to this earlier, in your organisation you can't do that much given the conflicts that are the root cause of these displacements, but what initiatives have worked elsewhere when it comes to protecting women refugees that could be replicated in North Kivu or Sudan or elsewhere?
So, as I say, in North Kivu, I mean, we've seen, and this is true, we're seeing around the world this widening gap. I mean, there is a massive. I'm not sure that people realize how significantly humanitarian needs have grown around the world. We're looking at more than 360 million people who are in need of humanitarian assistance. It's something like a 30% increase inside of 1 year. We've talked about multiple forced displacement crises in the context of this discussion alone, and so there's a number of things that are underpinning the inadequate response that we're seeing. And I have to be honest in saying that funding is simply one of them. There is a massive gap in funding. And as I say, it's not that we should expect Canada to be the sole source of fixing this problem, but certainly mobilizing the donor community to respond to neglected crises in Democratic Republic of Congo or in Rohingya camps in Bangladesh or Central African Republic or South Sudan or Chad. The international community simply needs to step up. Now, funding is one piece of it, but implementing effective programming also depends on humanitarian access. We need to be able to access populations in distress and in need, and they in turn need to be able to access us. So there is still a role for effective humanitarian diplomacy to create and protect humanitarian space. But also, ensuring that effective programming is being implemented by the international community. And I will say that includes a focus on local organizations. There are, particularly in the sexual and gender-based violence space, a lot of the protection services that are offered for survivors of SGBV are provided by local communities. And we do a lot of work to work and engage local feminist organizations, women's organizations, shelters, and so on, because they are often the ones who are most effective at providing, shelter, legal supports, that sort of thing. Hopefully that helps answer the question.
You have extensive experience in global public health policy. How do you assess the current state of global preparedness for managing humanitarian crisis caused by forced displacement? That's a very general question, but more specifically, you have experience in the field with various crises. Could you share your insights on the challenges of delivering health care in conflict zones and how Doctors Without Borders navigates those challenges? And if you can please describe the nature of the challenges and have they changed in recent years, been more acute in any particular area? If you could advise, this is the third question, if you could advise the committee on how you would triage Canada's support and involvement in humanitarian crisis, what would the immediate action be that you would recommend? And how would you speak, if you could speak directly to the Government of Canada, what would you tell them the priority should be, given limited resources?
Those are big questions. Okay. So how do I assess the general state of readiness to be able to respond to humanitarian crises? I'm going to go back to one of the things that I said earlier, which is that I'm not sure that the world fully realizes the scope and the scale of the emergencies that we're talking about. You know, as I mentioned, it's the 1-year anniversary of the start of the conflict in Sudan. We're looking at millions of people who are forcibly displaced, including millions of people who are forcibly displaced into South Sudan, which is a country that has been affected by armed conflict and humanitarian crises of its own for decades, as well as into the Central African Republic. I was in Central African Republic in 2022. I can tell you that access to healthcare is extremely limited. You know, similarly is a country that is affected by crises. People displaced into Eastern Chad, where you know access to humanitarian services is woefully inadequate. You know, what is the state of the global system to respond? We're stretched. We are extremely stretched. Needs are incredibly high. And these are complex crises where people's needs are covering, you know, healthcare, water and sanitation, access to food, you know, basic livelihoods. Children need to be in school and have access to education. I mean, there's a multitude of things that need to be responded to in multiple simultaneous crises. Now, I'm a healthcare professional, so I tend to look at these things through that lens. And, you know, again, considering the kind of global public health implications of these crises, we continue to be really quite alarmed that particularly coming out of a global pandemic, we continue to see, you know, smaller outbreaks of infectious diseases that go unresponded to. The world has not caught up on the gaps in basic things like measles vaccinations or you know, diphtheria, tetanus, and pertussis vaccines. You know, right now we are responding to the largest outbreak of diphtheria on record in West Africa. And similarly, we have responded to measles outbreaks in Democratic Republic of Congo and Nigeria and so on that have hundreds of thousands of cases. So, you know, I'm painting quite a bleak picture here, but the reality is that there are significant needs, and you know, people are fleeing and seeking safety. And we have to find some way of adequately responding to these needs. Now, in terms of the messaging to the Canadian government in support of humanitarian crises, I'm actually going to frame it in a positive way and speak about something quite positive that the Canadian government has done, and that's in its response to the Rohingya crisis. Canada, I was just in Bangladesh, I was in Malaysia, I was in the camps in Cox's Bazar talking certainly to Rohingya people, but also to the international community that is there. This is a forced displacement emergency where Canada stepped up. appointed a special envoy, has a Rohingya strategy that makes several recommendations, and Canada has played a significant leadership role, not only as a donor, and again, that's important, but also as an engaged country that has been pushing and trying to find solutions and engaged in advocacy to create humanitarian space and facilitate humanitarian responses and do a number of different things. And I think that is what Canada needs to be doing more of, is finding this way of being a good humanitarian actor, not just as a donor, but actually looking for that way to play a useful diplomatic role that allows us as neutral, impartial, and independent humanitarian organizations to do our thing, but recognizing that there is a role for countries like Canada to play on the diplomatic stage as well.
Do you have an insight as to why Canada stood up so well in Rohingya as opposed to other areas, and what can we learn from that? What's behind that motivation that produced a better result?
Yeah, that's a great question. I didn't make the decision, obviously, but I don't actually have the answer to that, to be honest. But I think that it's really worth some reflection, because the Rohingya strategy was renewed once. It came to an end, to the best of our knowledge, at the end of the last fiscal year. We have been saying that it should be renewed in hopefully tomorrow's federal budget. But it's a response that the Canadian government enacted, and I think it would be a moral failure to walk away from the Rohingya people, particularly at a moment where the international donor community is frankly withdrawing and turning their attention elsewhere. So having that sort of more comprehensive framework that empowered humanitarian diplomacy as well as humanitarian funding to principled humanitarian organizations that can go and do the work and deliver the services. There's something there that I think is really worth reflecting on, because these forced displacement crises are obviously complex. As I say, there's a service delivery need, obviously, but these are also political crises that require political solutions, and that's not the role of the humanitarian community. That's the role of political actors and states.
Thank you very much.
Thank you, both of you. And I'd like to also ask a question. It relates to the UN Relief and Works Agency and the fact that the cessation of funding, how it has impacted. And so I'm curious, how did that impact when donor countries withdrew humanitarian aid, particularly for Gaza? And what safeguards are either of you aware of that have been put in place since January to strengthen oversight, accountability, and transparency, not just there, but throughout the humanitarian aid sector?
To add on to that, I don't have specific comments on what UNRWA, how it operates and controls and things that it has. We simply just don't have visibility on that as an outside independent organization. So I can't comment on that. But what I will say is that we tend to focus on the logistics of the reality in Gaza, and that's obviously important. There's also the political reality of it. But establishing a sort of supplement or alternative to UNRWA de novo or from scratch in this moment is simply not realistic. It's not possible. It's not plausible. There needs to be multiple border entries and certainly an escalation of humanitarian assistance coming in. But there also needs to be a means of delivering that to the people once it crosses a border and enters into Gaza. And as I say, there's a political reality to that, and there needs to be clear assurances of safety and an ability to move humanitarian assistance and patients and supplies and so on in and around. And so, there's a safety and security element of this, but there's also clearly a logistic component to it that would be very challenging to reestablish.
I don't know if you can help with this, but you are in Canada, and what really concerns me is, compared to what Senator Simon says, Lebanon and Turkey, they get millions of refugees. Compared to that, we get very few refugees. And yet, our country or Canadians, Canadians really react to refugees, like, the Quebec crossing and all that. As politicians, have you got, not you aren't one, but what can we do to get across the message about what you are saying, the dire need, the dire need of people. It's people don't leave their home just because they decide one day they want to go to a better place. There is no better place. All places have their issues, and so, I'm a refugee myself, so I can say that with absolute conviction that your home is always the best. So, what is there anything us politicians can do to change that mindset a bit?
I can start. And I'll say a few things. The first is that, and actually I think this came up in the previous panel. The people are people. They're not numbers, and I think we need to be humanizing this discussion, both in this context, but also in public dialogue. Dr. Norman mentioned a reality that people are fleeing situations by boat. This is something that we see in so many places where we work. We run a search and rescue boat on the central Mediterranean because there is a necessity to do so. People are fleeing, a cycle of violence in Libyan detention centers, and they've ended up in a Libyan detention center because they are fleeing a situation generally of violence in another country. And they find themselves on the central Mediterranean in, flimsy boats, and thousands of people have drowned. People are making these journeys out of desperation. And these are impossible choices that people are making. When I was in Malaysia in February, it's a very similar story. There are Rohingya people who arrive in Malaysia, some of them by boat, many of them also by land routes, incredibly dangerous. And people are fleeing conditions in the Cox's Bazar refugee camps as well as in Myanmar, where they're subjected to violence, oppression, a lack of rights, no opportunity. And when you talk to people about what they want for the future, I can't speak obviously for the community, but so many people tell us and told me that they want to go home. Right? This is fundamentally what we all want, is people want to go home. They want to have access to their land, to freedoms, their rights, and to dignity. And I think we need to find a way of humanizing people, and talking about numbers is important for people to understand the scale, but ultimately these are people who are seeking very basic, freedoms and a better life for themselves and for their families.
Let me pick up on something that resonated with me that Senator Jaffer said. I too am a displaced person, and I too know that home will always pull you back, because that is a normal human desire. And given that there are so many displaced people in the world who require help, and given the fact, I'm pragmatic about this, no country will agree to massively increase the numbers of resettled refugees. And we've heard that Canada is, in fact, decreasing the numbers. So given that statement, do you, Dr. Norman, Dr. Nickerson, would you agree that it is best for Canada to encourage regional arrangements, let's say through the ASEAN countries, vis-a-vis the Rohingyas, or through, let's say, what Colombia and Ecuador have crafted through the Quito Agreement to resettle, to normalize Colombian, Venezuelan refugees, and to some extent what Jordan is trying to do? Do you not believe that instead of bringing people, uprooting them from places where the weather is different, the culture is different, the language, should we not focus more of our efforts in keeping them safer in the regions and at some point managing a safe return? It just begs the question.
I think that there's an important distinction. So first of all, I'll say that, and I'm sure that you would agree with me that, whatever option is put on the table needs to be voluntary and dignified, right? I mean, people and affected communities need to be consulted about what it is that they want. And earlier there was mention of the situation in Libya with the detention centers and so on, and the reality that there's been a tremendous amount of European funding that has gone into supporting the Libyan Coast Guard and some of these detention centers. And I think that there's a note of caution in there that countries like Canada need to pay attention to, in the sense that regional solutions need to not be conflated with policies of border externalization and containment. And I think that there's a real potential there for a slippery slope of sorts, and the sort of externalization of borders, and people being told that they need to stay somewhere and that they can't access certain asylum pathways and so on because they need to stay in a region or stay in a country or something, is frankly an affront to people's dignity and a right to seek asylum and to seek safety. And in the context of Libya, we've seen that go terribly awry. We are one of the few international organizations that has worked inside the detention centers in Libya, and have had medical programming there for several years. Several of those programs or projects are winding down because of a lack of access. But just to say, the conditions have been absolutely abhorrent. So I think whatever solutions are being put on the table, we need to keep, the reality that it needs to be through consultation with the affected communities, and it needs to have principles of dignity and voluntary, choices put at the center of it.
Thank you to our witnesses. I want to sincerely thank both of you for attending and for participating in this important study. Your assistance is greatly appreciated.